trying, but they cannot, then what is causing that? I know you've mentioned something about breastfeeding.
Yes.
But how long can it go on? And when you talk about secondary infertility, can it be cured as compared to primary infertility?
I'll take a step back, if you don't mind. I'll take a step back and say, first of all, talk generally about infertility in men, the causes of infertility in men. I can start with, without any hierarchy of importance, start with infections, for example. Here we talk about infections, sexually transmitted infections. For example, gonorrhea, syphilis. There was an article, I think it was yesterday or the day before yesterday, about an explosion of syphilis infections in the country. And then we have another bacteria called chlamydia. Chlamydia is a horrible sort of microbe because what it does in women, for example, it causes what we call adhesions. Now, for men, it also causes the same thing. Chlamydia has no symptoms, it has no pain and whatever. So unlike the other bacterial infections. In gonorrhea, of course, you're going to have pain, you're going to have a discharge, and so on and so forth. Chlamydia doesn't. What sexually transmitted infections do, they lead to the blockage of tubes. Now, if I can go a little bit into the anatomy of the male reproductive system, we have the testicles, and then from the testicles, we have tubes which come down, and added onto the tubes, attached onto the tubes is what we call ejaculatory ducts. And these tubes come down and they get into the prostate gland. And from the prostate gland now, there's a tube now which comes out called the urethra. And the urethra, now during intercourse, what happens when a man is having an orgasm? By the way, sperm is produced elsewhere and is stored elsewhere. Only that during intercourse, the sperm moves from where it is stored in microseconds, travels very quickly into through the prostate gland, where it is mixed with what we call seminal fluid, and then it comes out as an ejaculate. Now, the psalmist says we are beautifully and wonderfully made. Some of these things we don't actually appreciate, we don't know about them because we think it is normal. Now, what happens with the infections? Sometimes the infections can block those tubes where the sperms are supposed to pass through. So whatever comes out during an ejaculation is only seminal fluid from the prostate gland, but there are no sperms. Now, is that correctable? Because you're asking some of these causes, can they be correctable or uncorrectable? Like that one, it is difficult to correct that blockage because first of all, the tubes are very tiny. And if you're going to try and open that blockage, you may cause more harm. But there are options of treatment where we can circumvent that process. You may have a problem with infection of the testicles themselves, especially when you have what you call viral mumps infections. When this happens in childhood, it's not a big problem. It is actually even encouraged. But when it happens in maturity, it actually, in a trauma, quote unquote, in a trauma testicles, what happens is that infection affects what you call seminiferous tubules, and then there'll be no production of sperm. Sometimes you have what you call undescended testicles, where the testicles normally, when a baby child, a boy child is in the mother's womb, the testicles are in the abdomen, and they're supposed to come through an opening such that they get into the scrotum. Sometimes that doesn't happen. It can be on one side or it can be on both sides. This usually is discovered very late in adulthood. When this gentleman is married, in trying to have a baby, it's